Thank you, Mr. Speaker. Mr. Speaker, honorable members, as you see our guests here from the right, they are a batch of doctors and nurses from the USA and Sierra Leone. The organization is Healthcare Sierra Leone. And as you know, health is wealth. We cannot move without a healthy body. So they are in Sierra Leone. They formed themselves into an organization wherein they have decided to come back home to give back to the people. They have gone to Potloko, Makeni, Royanka, and this time the lots fall on Moyamba district, where they were for the past weeks. They were there treating people for free, all ages, children.
You did not start with parliamentarians.
Yes, they are coming. Women, children, old and young. Yes, honorable members, they have not started, but they have gone to your people. So it's a plus to all of us. And for Moyamba this week, they treated about 1,500 people. And they went back to the peninsula. They were there these past days treating people for free. So, Mr. Speaker, honorable members, they are here this morning. They are from Moyamba district. They are here this morning for us to join me to appreciate their effort for what they have done or what they've been doing for the people. And we want them to do more, because this is just a start, and we are going to do like what Oliver Twist did. Please, sir and madams, we want some more. As you know the problem in Sierra Leone, you know our problems, you and I know, and the way our people are suffering. They go to the hospitals to get, even to afford Panadol, they have to go from point to point to come and buy Panadol. But now you have allayed that one. A few days ago, you gave so many drugs to the people of Moyamba district. So I want to say thank you. And also on behalf of the people of Makeni, Royanka, Lunge, and the Peninsula, I want to say thank you. The others, please don't worry. They are going back. They will come very soon. They are here and they have seen the problems that we have in our country. And I hope you go back to the US and you live with the others, because we have Dr. Soko Kadia here and the other young doctors. You will hear their names and they are here. I know they will do more. They will help us so that they can continue with the good work of the healthcare. So with that, the chairman there, Mr. Pierre, can you please rise for the people to see you, the honorable members? That's Mr. Pierre, born of Tayama, Moyamba district. He's the brain behind everything. So I want to say on behalf of Parliament and the people of the areas that you have gone, and yet to go to the other areas in the other provinces, because we have 11. You have heard now from Parliament. You need to come to Parliament. You have to give us one time so that you can come to Parliament to see, so that we too can enjoy these facilities. Thank you very much. We appreciate you, and we hope to see you again. Thank you very much, sir.
Lady, for our statement and for introducing our distinguished guests this morning.
Mr. Speaker. Sorry, sir. I'm really sorry. But it's your leave.
Very well.
Thank you. Thank you for, sorry for the interruption. Thank you for giving me the floor. I want to join one of our oldest and senior colleagues in the House, the leader of the Australian delegation to the AC people, to the ECOWAS Parliament, and also the president for the ECOFEPA. Mr. Speaker, as I said, I want to say a big thank you to you for giving her the floor and by extension to me. But we want to climatize this process by the committee meeting with them, our health committee, to show that there is a parliamentary committee who are in charge of health so that they can interface. They are doing a very good job. I don't want to join her to say thank you very much. And we cannot pay you, but your pretenses will pay you. You have done what you could. They are going to ask you what you have done for your nation. That is exactly they have demonstrated. Going for greener pasture, if you achieve what you want to, this is what you give your people as a service. Health is our biggest challenge as a nation. In fact, it's a global challenge now. We are trying our best, but we have the private sector coming in, which we are anticipated for, Mr. Speaker. Thank you very much, Honorable Veronica KCC, for bringing them on board. And thank you, Mr. Speaker, for giving her the floor, for telling us about these great people, the Israel and what they are doing. So, as I said, the health committee will meet with them after sittings, and we have a one-to-one meeting so that they can be in touch with areas that they are going, and MP can tell them more. The end note, we are sick. We need them to see us. We need some drugs. We have so many patients, Mr. Speaker. We have patients who, we sit here, we are professional doctors, very professional doctors. We are physicians, we are gynecologists. You call them. Oh yes, if you take my phone this time, somebody will say, oh, I've gone to the hospital to do delivery. Oh, I'm sick, I need operations. We have done all those operations. But our professionalism is in terms of physical policies that we give them money. So thank you very much, Mr. Speaker, for giving the floor. Madam, I salute you. And people will criticize you. But your conscience is served and your God with your nation first. Push, we succeed, we are with you. If we have policies gearing towards the health sector, anywhere you are, this parliament is a very progressive parliament now. We can make your input into that particular policy that we are going to enact in parliament. The best we can give you is to make sure we have better health policy that encourage all sectors of people that are wanting to help us to come on board. So that is what we can do as parliament. Thank you, Mr. Speaker. Thank you. Yes, Mr. Speaker. Mr. Speaker.
I know the other member from Moyamba district has been itching to catch my eye, to have a say in this important and auspicious moment.
Thank you, Mr. Speaker.
I'm not giving you the floor.
I will tell Mr. Speaker. Thank you for even recognizing me.
I'm not giving you the floor. The leader of government business talked about all of us being doctors. I think let us qualify that so that we are well understood. SO2 will be pepper doctoring ourselves. You have the floor.
Thank you very much, Mr. Speaker. I want to join the senior colleagues for appreciating the efforts of the medical team from the United States of America to supporting our people, especially from my district. I want to thank them for that humanitarian gesture they've extended to our people from that part of the country. However, Mr. Speaker, just like the leader of government business rightly outlined, let's have it in a structural form, like engaging the committee, and for subsequent engagement in districts, the MPs in that district must be informed, and because we have people who are eagerly waiting for such opportunities to be given to them, but they don't have the financial support. So if we have a medical team that is giving these services free, I think it's but fitting that the members from that district be earlier informed so that they can help their people to access these facilities. Because for me, it's a laudable venture and it's very good for them to be in my district but I'm only coming to know that they are just coming from my district through the presentation of the senior honorable member. On that note, I want to thank them, and I want them for subsequent engagement across the country. Let the MPs of this district be involved so that they can let the people to come out and play the district. Thank you very much.
I thank the honorable member for his contribution. Let me say this to our distinguished guests, that the sentiments you've just heard have all come from one side. That's the government side of the house. But it's never complete until you also hear from the opposition side. I would like to give the floor to the leader of the opposition.
Mr. Speaker, let me, on behalf of this Parliament and by extension the government of Sierra Leone, express our profound thanks and appreciation to the team. And similarly, please permit me to express similar sentiment to the previous Mama of the House. Now is the Mama of West Africa. She has been promoted to the Mama of West Africa. We want to thank you and may God bless you. But like the leader of government say, we would want to let the team coordinate with the committee on health, because all of the places that they're going, they are reducing the burden on members of parliament. I could remember in the last parliament, when members of parliament were questioned as to what are their roles and responsibilities in their constituency, most of them stated that they've taken care of the medical bills of thousands of their constituents. So if the member of parliament joins the team, it will give more authority to the team that came, and they will be more empowered in the various districts that they're going. So I want to reiterate what the leader of government business just said, that they should work hand in glove with the committee on health to ensure that it is participatory. So once more, on behalf of the opposition, we want to express our profound thanks and appreciation. And we pray that this is not the first and the last that will be coming here again. May God bless you.
I thank the leader of the opposition for his kind sentiments. Let me now exercise the privilege of having the last word on this. But before I do, I think it would be appropriate to introduce the members of the visiting team by name. The chairman has already been introduced by the honorable lady. I hope he doesn't mind rising again to be acknowledged for the second time. Dr. Pierre, Madam Finda Kai Kamachende, Madam Fatmata Tarawali, Dr. Fuad Sharif, Mr. Cherno Abubakar Bari, I see a name that is most familiar, Madam Kadi Balajal. Abdulaziz Suma, Salu Alpha, Umar Ba, Ishmael Ba. Is he with us? Oh, he's over on that. Thank you. Mohamed Toure, Lulu Abba, Charlotte Israel, and another familiar name in this country, Dr. Soko Kali. Angela Dumbuya, Bridget Ahmed Mbayo, Ella Smart, Josephine Kamara, last but by no means least, Janet Kelly. I hope I have not omitted anyone. I want to take this opportunity on behalf of the entire party, as you well have noticed, both sides of the house, to compliment you for your humanitarian gesture and to express our warmest gratitude to all of you for coming to our country and to give to the people of this country the service that is so badly needed by everyone in this country, medical staff. I'm sure the places you visited may have said this to you, that after treating the people you met, you would not want to see you go back. But alas, you have to. But let us say, you leave us with the expectation that you'll be coming back. We appreciate the services you've given to our people. We can't thank you enough. In our traditional way, we will pray for you and say, may God shower you with his richest blessings for the good services that you render to our people. Thank you on behalf of that. I don't know whether you have other engagements, but unless you want to continue to observe our proceedings, otherwise you are at liberty to take leave. And good luck and safe journey to all of you who are traveling back with your respect.